Us today is the Honourable Andrew Furey, Premier of Newfoundland and Labrador, the Honourable John Hagge, Minister of Health and Community Services, the Honourable Tom Osborne, Minister of Education, and Dr. Janice Fitzgerald, Chief Medical Officer of Health. Please stand by. Our news conference will begin shortly.
Thank you, everyone, for joining us this afternoon. I'm sure that the moment you hear that there's an unscheduled media briefing, your anxiety levels rise. Trust me when I say we don't want that. The safety of every Newfoundlander and Labradorian is our top priority. With that in mind, and maybe it's the medical training and Doctors Hagge, Fitzgerald, and I, we want to talk to you today about some preemptive measures we are putting in place to combat this latest surge in COVID-19. Especially with the new variant happening all around us. Trust me when I say these decisions are not easy. They are made collectively based on advice from public health in order to keep us all safe. I'm sure you've seen the news from the mainland and around the world. Once again, the specter of a surge is on our doorsteps, and we need to address it now before we suffer the same fate. I know it couldn't come at a worse time, cruelly even. We are all looking forward to the holidays together, family coming home, gathering together to celebrate our faith, a time to give and feel joy in each other's company. My friends, COVID cannot take that spirit from us. It will not. We just need to, again, as we have so bravely done in the last 2 years, step up and face the reality of this situation. We will face it together. Our province has one of the highest vaccination rates on the continent. We made it through lockdowns and strict measures. We are every bit the determined, never stop souls we have always been for generations. When hardship is in your blood, but your heart is full of optimism, there is nothing that can stop you. Looking at what's happening around us, we know, simply, the math does not lie. This new variant is more contagious, and it is here amongst us. But it will be met by a wall of our collective will. Today, we will announce preemptive measures as our first defense. Now, I know I am asking the weary to find energy to fight some more, but I also know who I'm asking. The people of this province have the courage to see this through, the love and compassion to help us all get through it together. With that, now I'll turn things over to Dr. Fitzgerald for an update and an update on our preemptive measures. Dr. Fitzgerald.
Thank you, Premier. Thank you all for joining us this afternoon for this unscheduled briefing. Since our media briefing on Friday, we have confirmed 61 new cases of COVID-19 this weekend. 18 are in Eastern Health. 1 is a contact of a case, and the other 17 are under investigation. There are 32 cases in Central Health. 21 of these are contacts of cases, 10 are under investigation, and 1 is travel-related. There are 10 cases in Western Health, 4 are contacts of cases, and 6 are under investigation. And there is 1 case in Labrador Grenfell Health, which is under investigation. There have been 10 new recoveries, 2 in Eastern Health and 8 in Western Health, leaving 127 active cases in the province. The total number of cases for our province is 2,213. No one is hospitalized as a result of COVID-19. And 2,050 tests were completed since yesterday for a total of 361,177 to date. We have 9 confirmed cases of Omicron and 34 presumptive cases of Omicron. In Eastern Health, there are 5 confirmed and 7 presumptive cases of Omicron, and in Central Health, there are 4 confirmed and 27 presumptive cases of Omicron. We are very concerned with the rapid spread occurring in the central region. Effective midnight tonight, Badger, Grand Falls, Windsor, Gander, and Twillingate will move to alert level 3. We recommend avoiding travel in and out of these areas unless it is for essential reasons, such as work or medical care. Weddings, funerals, burials, religious and cultural ceremonies are limited to 100 people or 50% of venue capacity, whichever is less. Public visitations are permitted with 1 household bubble visiting at a time, and wakes are prohibited. Performance spaces, cinemas, and bingo halls are closed. Informal gatherings, such as those in the home, are limited to your household steady 20. Fitness facilities, swimming pools, arenas, and dance studios are permitted to open with a maximum capacity of 100 people or 50% capacity per room or ice surface, whichever is less. Physical distancing between households must be maintained. Restaurants are open at 50% capacity with physical distancing, and bars and lounges are closed. Amateur sport and recreation activities are limited to team practice and training only. Competition and training with other teams, even within the association, is not permitted, and work from home is recommended where possible. The rest of the province outside of the impacted areas of Central Health will be in alert level 2, effective midnight tonight, as per the restrictions we announced this past Friday. We are also putting additional restrictions in place for travelers. The evidence of Omicron shows that there is immune escape, and this means that anyone fully vaccinated can still get and transmit COVID-19, and indeed that is what we are seeing. Effective 3 p.m. on Tuesday, all fully vaccinated travelers will need to isolate for 5 days upon arrival. They will need to take a rapid test every day for 5 days, and if they are all negative, they can leave isolation after 5 full days or 120 hours have passed. Anyone arriving in the province that has visited a post-secondary campus outside of the province in the last 14 days and who is fully vaccinated must abide by these new isolation requirements and are also still required to have their arrival PCR test. If both the PCR test and the 5 rapid tests are negative, they can leave isolation after 5 full days have passed. Children between ages 5 and 11 that are not fully vaccinated and are traveling with parents or guardians that are fully vaccinated will also need to self-isolate for 5 days with 5 rapid tests. After 5 days, they will then follow modified self-isolation until 14 days have passed. It is not mandatory for children under 5 to have a test as long as the parents and guardians have their rapid test. They can leave full isolation with the parents and continue on modified self-isolation until 14 days have passed. Rotational workers that are fully vaccinated will need to book a PCR test between days 0 and 3 and take a rapid test each day for 5 days and can follow modified self-isolation for 5 days. Provided their rapid tests are negative, they can end modified self-isolation on day 5. There are no changes for anyone not fully vaccinated. These travelers must still isolate until they receive a negative PCR test on day 7 or later and are then subject to modified self-isolation for the remaining 14 days. I know that there are many travelers coming into the province this week for the holidays, and the timing is terrible. Unfortunately, more movement and travel is what COVID-19 thrives on. Right now, the public health is operating at full capacity for contact tracing and investigation. Because Omicron is so infectious and spreads so fast, we know that by the time we find a positive case, the virus has likely already spread onwards. Jurisdictions across Canada are reporting record numbers of new daily cases. We have a lot of work ahead of us to manage the outbreaks that we have, and we cannot afford to have new outbreaks through the importation of new cases into the province. So this is our way to try to reduce that risk. As difficult as the self-isolation requirements for travelers were for the 14 months that they were in place, they were key to helping Newfoundland and Labrador avoid the substantial impact of COVID-19 that other jurisdictions experience. These are temporary measures to help us during this critical period. When it is safe to ease restrictions, we will do so. If you have family and friends coming after 3 p.m. on Tuesday, you can choose to self-isolate together with them. And if their 5 days of rapid tests are negative, everyone self-isolating with the traveler can then leave isolation. As I indicated Friday, we need to be prepared for changes and possibly with little notice. The combination of these new measures will not only help us preserve capacity in healthcare, but may possibly help to delay or avoid the need for additional restrictions within the province. No doubt this will be a difficult holiday for many people this year, and for several reasons. Please reach out to those who may be anxious or alone this season. The best gift we can give this Christmas does not come from a store. It's our love and support. So take care of yourself and look after your family and friends, and please hold fast. Sorry.
Well, thank you, Dr. Fitzgerald. It's certainly not the news any of us want to deliver, and thank you again and your team for putting through the best advice and going through one heck of 18 months. That we greatly appreciate it. With that, I'll ask Minister Hagge for some brief comments. Minister? Minister, I believe the phrase of the year, you're on mute.
It is indeed. I unmuted one, but not the other. Thank you. Omicron has arrived as we knew it would, and it has done what Delta did before it. It has risen in numbers very rapidly. The measures that are announced by Dr. Fitzgerald today are aimed at dealing with what we know about this virus. It's introduced by visitors, and it's spread by contact. And so the measures that have been announced are designed to safeguard travellers and people who would come into contact with them, and also to minimize the number of casual contacts over the course of a day. You may remember back in 2020, one of Dr. Proton Rahman's earlier presentations showed that if your household bubble could keep its contacts less than half a dozen, outside of the bubble, the chances of this virus spreading and causing trouble was very much reduced. There are level 3 changes for communities in Central, and the interactive map to help you locate those is available online, or will be by the end of the afternoon. It is essentially the communities of Grand Falls, Windsor, Badger, Gander, and Twillingate. Public health there is going to provide regular updates to the mayors and the MHAs there in the way we did on the south coast at Marystown. So with that, Premier, again, I would echo what Dr. Fitzgerald said. Hold fast. We've been here before. This was what happened with the Mount Pearl Senior High outbreak. The difference here is we have a somewhat more contagious variant. We will get through this. And with that, I'll hand it back to you, Premier. Thank you.
Well, thank you, Minister. I'll now invite Minister Osborne to give an update on the school situation throughout our province. Minister.
Thank you, Premier. I'm here this afternoon to advise of changes to the K-12 schedule heading into the Christmas and holiday break. Classes in the K-12 schools, with the exception of those that have been closed in recent days by public health, will be open tomorrow, Monday, December 20th. However, schools will close to students on Tuesday and Wednesday. Classes are still scheduled to resume on January 4th, the first day after the break. Let me be very clear. At this time, public health continues to advise that schools are safe to remain open, and we have not made a decision to pivot to online learning at this time. However, in light of the uncertainty around where things are going with this variant, we are erring on the side of caution and preparing for that possibility. We have made the decision to remain open for one day to allow schools to clue up any outstanding business that they had planned for this week. For instance, that might include assignments or home studies or much needed face-to-face time that a student may need with an educator. We also recognize that some families will need to arrange childcare. At this time, we are asking students to take home any supplies they may need on Monday, including Chromebooks for grades 7 to 12, in the event that we have to move to online learning after the break. On Tuesday and Wednesday this week, educators and staff will prepare for a possible shift to online learning in January. Schools will be available for them on these days. During this time, school administrators for K-6 classes are asked to bring preparations for the distribution of school-based devices based on the information that they have collected from the school communities and on the availability of personal devices for students. Classes will resume on January 4th, 2022, either in person or online. So we are giving educators the 2 preparation days now so they can hit the ground running after the break, regardless of format. We are giving this prep opportunity now because we know it is safe to do so today. This situation may or may not change, and it may not be as safe in January to prepare for online learning. We cannot predict that at this time. Again, no decision has been made to move to online learning at this time. We are simply being proactive. Another important point that I wish to make for parents of K-6 students who have COVID-19 vaccination appointments scheduled for Monday, Tuesday, or Wednesday at school, your appointment will still be available at the scheduled time. We have said all year that our priority is to keep schools open whenever it is safe to do so, and that remains our priority. We will continue to work closely with public health to make these decisions in the interest of public safety for students and educators. I want to take the time to thank educators, staff, students, and families for their efforts this year to follow public health protocols and to keep our school community safe. Thank you.
Thank you, Minister. I'll now invite questions from the media.
Thank you, Premier. Today we have 5 reporters joining by phone. The first round of the question and answer session will give each reporter the opportunity to ask one question and one follow-up. Following this, there will be a final round where each reporter will have the opportunity to ask one final question. Our first questions are from Peter Cowan with the CBC. Please go ahead.
Dr. Fitzgerald, just a couple days ago, you were saying that you didn't want to bring in any sort of border measures in place. Can you explain why the change of view and why the decision to delay it until Tuesday? Are you not concerned that some people will just simply move up their plans, everyone will rush to get in order to avoid isolation, and you'll still have all that travel and people won't be in isolation?
So you're right. 2 days ago was a very different picture than what we're seeing today, and certainly what we've seen in the last 48 hours or so is a lot of travel-related cases. So we really do feel that we need to put these measures in place right now to keep people safe and to maintain our public health capacity and health system capacity. So we have tried to give people time to be able to cancel their plans if they had them in place. I think everybody across the country realizes the gravity of this situation and understands the gravity of this situation. So, I think cooler heads will prevail and people will make the decision that's right. I don't anticipate that we'll see a lot of people moving up their plans. I've certainly heard of a lot of people changing their plans already. So, at this point, I don't think that will be the case.
And considering there are a lot of people who've already traveled in advance of this, why isn't there testing options available? I know, for example, some people who arrived before test kits were available and they've even gone back to the airport to say, hey, can I get one? Because I want to be able to do these rapid tests, and they're still not available.
So, with any plan, it has to start at some point. And so it is certainly if anyone who's traveled in here, if there are concerns and they want to get a test, there are options available for them to get a test. Anyone with symptoms can book a test online. Anyone who has to book a test because of travel can book a test online. Since Friday, anyone who's coming in is getting the 5 tests. So, we're moving forward and trying to deal with the situation as it presents itself to us. And, but there does have to be a start date to everything. So.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you. A little bit of a follow-up to Peter's question. With these rising case numbers, could we potentially see more rapid tests being made available to the general community so that people can get those tests done on their own and test to see if they have the virus?
As I said previously, we are looking at the ways that we can use this test most efficiently. And, if simply doing rapid tests was what was going to keep this from happening, then there would be a lot of jurisdictions in this country who wouldn't be where they are right now. So rapid tests are not the entire answer to all of this. We have to use these tests as judiciously as we can in the areas that we can to make sure we're getting the best information from them that we can. And that may not be everybody in the province using these tests, just because they may want to go to, an event or something like that. We have plans on how we'll use them in schools, especially for students who may live a distance away from testing centers so that if they're symptomatic, they can get tested. We know that the tests perform better when people are symptomatic and use them. We also have plans to use them in situations of outbreaks where we may need to test a lot of people at a time. And so for some of these lower risk contacts, they may be a very good use. of that test and to be able to preserve our PCR capacity. So there are lots of ways that we can use these tests effectively, and in the coming days to weeks, we'll certainly be coming out with that.
And a question for Minister Osborne. You mentioned that students who have a vaccine appointment booked through their school will still be able to get those on Monday, Tuesday, Wednesday. On Tuesday and Wednesday, for the days that schools will be closed, can you just walk us through how that process is going to work for parents bringing their kids in to get those vaccines?
Thank you for the question and the opportunity to get the message out for parents and students who have an appointment booked. So if the appointment is booked at a school and scheduled for one of those days, parents simply bring their child to the school and can avail of the vaccination that was previously scheduled. These will not be cancelled. It's important. Vaccination is our best defence, in addition to masking, social distancing, and other measures. So we don't want to cancel the vaccinations that have been scheduled. They will be available. Parents simply bring their children to school and receive the vaccine.
Our next questions are from Ronelle Legros, all Newfoundland, Labrador. Ronelle, please go ahead.
I'm wondering about informal gatherings. Are they still limited to 25, or has that number been reduced to 20?
It depends on the zone, but Dr. Fitzgerald, do you want to go ahead?
Yes, sure. So in level 3, what we're asking is that you limit your gatherings to your steady 20. So we wouldn't want a gathering size to be any bigger than that, but at the same time, we want you to be sticking to those 20 consistent contacts that you have, so that you're keeping your total number of contacts low. Outside of level 3, it's at 25. But, as we've said many times before, just because you can have 25 doesn't mean you should. And if you can keep that level, that number down, then we would certainly want you to do that. And to keep it to those, close contacts who you are seeing frequently, and not, and trying to limit the number of gatherings that you're having over the holiday season. So reduce your number of contacts as much as you can.
And Dr. Fitzgerald, you also recommended folks work from home where possible. Wondering if government workers, if the public service, if this means they will in fact be working from home on Monday.
So I'm not sure that that's actually my question to answer. Sorry.
My understanding, Ronelle, is that if you are a government employee and can work from home, then, that will be accommodated, particularly if there's a childcare issue. Monday shouldn't be any concern for those areas where schools have not already been closed because of public health reasons. It's really just Tuesday and Wednesday morning. So my understanding is, as I've just laid it out. So I don't know whether that completely answers your question, but that's the best I can do at the moment.
Our next questions are from Ben Cleary with NTV. Ben, please go ahead.
Hi, and thank you. My first question is for Minister Osborne, and that's what should parents and students, what do they have to do tomorrow to prepare for the holiday break?
So for students, educators and staff at the school, tomorrow is a normal school day. We expect the school day to be the same as any other school day. We're simply closing on Tuesday and Wednesday. So on Monday, students will bring home any and all materials, including Chromebooks, that are required to revert to online or virtual learning should the need occur on January 4th. For educators, those 2 days are the prep days for educators to allow them to get ready to do virtual learning for their students. Schools are open for educators and they will prepare. As I said, it's safe to do so on Tuesday and Wednesday. We're not certain if it will be as safe in January, which is the reason we're making this move now, so that we are prepared for virtual learning, and educators, students, and parents are prepared for that in January if the need arises.
Thank you. And Dr. Fitzgerald, I noticed you got a little emotional in your preamble. How hard is it to implement these restrictions so close to Christmas and over the holiday season?
Yeah, they're hard at any time. They've never been easy. And I think it's just, I think it's just, it's been a hard weekend, and I've been on call, so it's, I think emotions just got the better of me there. But, these are incredibly difficult restrictions to be putting in. We know that. We've known that all along. It was the last thing really any of us wanted to do. So trust me, none of us are taking this step lightly. But at this point, I don't see another way of really being able to try to curb and slow the spread, so that we can handle what comes to us.
Our next questions are from Peter Jackson with the Telegram. Peter, please go ahead.
Good afternoon. I think this would be for Minister Hagge. I'm wondering how many rapid tests we have received in the past 48 hours or so, and what is our current number on hand?
We've received 250,000 kits over the course of Thursday night onwards. We are expecting another 1.5 million. Those will arrive over the course of the next week or so, and certainly that number is anticipated to be complete by the end of December. Our challenge is that there is a global shortage of these kits. They are at all points of entry currently, save for, according to my information, the ferry at Fortune, and I'm not sure whether the St. Anthony and Goose Bay airports have got theirs yet or whether they'll arrive tonight.
Okay, thank you. This is either for you or for Dr. Fitzgerald, but the Chief Science Advisor of Canada, among others, has said that these kits really ought to be in the hands of the public, that it should be up to them to also be doing their part individually to try to prevent this spread. What do you say to that fact that we are still one of the few provinces not distributing these widely?
I think from my point of view, we take the advice of Dr. Fitzgerald's team. This is a newish development for us in terms of how you use them, and we've had a debate going back to almost the onset of rapid tests. And remember, there are two types of rapid tests. There's one self-administered, which I think is what we're talking about at the moment, and one that is laboratory or laboratory equipment kind of based. So that's a separate entity. We've had such a low prevalence that our advice has always been to reserve these for specific situations. Dr. Fitzgerald can elaborate further, but quite frankly, our advice at the moment is things have changed. Let's change.
Did you have anything to add, Dr. Fitzgerald?
No, actually, I think, as I've said many times before, we want to make sure we're getting the best use of these, and they're giving us the best information that they can. And we're certainly considering this very carefully. And, our testing strategies up to this point have served us well. And we're really trying to find they're a great tool, and we want to make sure we're using them as effectively as we can.
Peter, I'll just weigh in here as well. These are the conversations that are happening across the country and with different premiers and the supply chain. And we're working very hard and collaboratively with our federal counterparts to ensure that we are securing the supply chain as the prevalence changes. But these are issues as they were distributed across Ontario. I know that there's issues even there now. So this is something that's occurring across the country right now and around the world, as the minister suggested.
Thank you.
I will now go back through each reporter to see if you have one final question. Peter Cowan with CBC, do you have a final question?
I do. Why did you decide on 5 days for isolation as opposed to the traditional 14 that we had been using all along, or the 7 that we've been using for close contact? And considering the evidence shows that a booster shot gives much better protection against Omicron, why are people with a third shot not exempt from these new measures?
So we chose 5 days. I think, we're looking at Omicron and it's the way that it's being transmitted, and certainly we're seeing a much shorter incubation period. We're seeing people now who are becoming symptomatic, 36 hours, 48 hours after they've become exposed. So a lot of people are actually, I feel like more people will be picked up in that shorter time period. And so we're trying to find and strike a balance between getting the best protection we can with a quarantine period and allowing as much freedom as we can for people who are either coming home or coming to visit. And with the addition of the testing on there, I think that helps us to feel that much more safe in that regard. And what was the second part of the question, Peter?
Was around, if you've got a booster shot, we know you get better protection against Omicron. Why not exempt those people from quarantine?
So we don't have a whole lot of information about Omicron and booster shots. We do know there have been some small studies that have shown that a third dose may be more protective, and certainly we have seen, like in the UK, for example, they have seen that. However, we have seen that we've also had people who've had 3 doses and have become infected. So, certainly from a protection against severe disease, that will probably be the case. But when we're talking about transmission, we don't have all the information that we need yet. We're still very early stages of the game, and we may get to a point where we can say that 3 doses means you don't have to isolate. And, I hope we do very soon, but we're doing this temporarily so that we can buy ourselves some time till we get the information that we need, until we know what the outcomes are going to be and how this is going to affect health system capacity. Hopefully we'll be able to get that information in the near future.
Richard Duggan with VOCM. Do you have a final question?
I do. Dr. Fitzgerald, you said earlier that public health is concerned with the amount of spread that we're seeing with Omicron, particularly in the central region. Do you anticipate that we'll continue to see these high daily case numbers now moving forward, at least in the immediate future?
Yes, I do. I think we're going to continue to see increases in cases. We'll have contacts, of course, who will test positive, as we always have. But I think, given what we're seeing elsewhere in the country, it's almost inevitable that we're going to see more importation of this virus. And I think that's one of the reasons why we wanted to bring these measures in now, while we might be able to get ahead of it. So certainly we are anticipating that we're going to see more cases as the next few weeks move on.
Richard, that's consistent with across the country and what we know about this virus in terms of its transmissibility and the doubling time. Everyone can do their own math. The doubling time is quite frightening on this, anywhere from 2 to 3 days. And that's why it's so important, even though the time of year is not right for everybody, and it really is terrible news to have to deliver right now. It is the right news that we have to intervene like we are today.
Ronelle Legros, All Newfoundland, Labrador. Do you have a final question?
Yes, my question is for the Premier. As necessary as these measures are, I'm wondering what your message is today for business owners who are now facing restrictions. Some have to close their doors ahead of one of their busiest seasons of the year.
We certainly appreciate that this is incredibly difficult timing for businesses across the province. we will be there to support them through it. This is an acute situation, obviously, and we'll work through how we've been there in the past and how we will be there now for them. It's an incredibly difficult time of year, but this is all in an effort to protect our economy in the medium term and to protect our ICU and hospital capacities so that we're just not overrun. It's an unfortunate but necessary measure, and we will work with them and their associations to ensure that we are supporting them through this difficult time.
Ben Cleary of NTV, do you have a final question?
Yes, and thank you. Can you walk us through again, Dr. Fitzgerald, exactly how many cases of the Omicron variant are in the province? And I guess this is a double-edged question. What's the latest information? What do we know now about Omicron in terms of how it spreads and things like that?
Just 1 second now. I have to pull that up again. So, numbers-wise, for Omicron right now, we have 9 confirmed cases and 34 presumptive cases. In Eastern, 5 confirmed, 7 presumptive. Central, 4 confirmed and 27 presumptive. And with regard to spread, we know that this is spreading quite rapidly. We know that it can be very easily transmitted, and we're certainly seeing evidence of that in our in the cases that we have so far. And we do know that vaccinated people who have 2 vaccines can get it. So far, most, if not all, of the cases have mild disease, which is very reassuring. But again, still very early days in that. So we are seeing that it's spreading much more effectively and much more rapidly than the previous variants and even the original strains. We're seeing, on average, an incubation period, I would say, around 3 days at this point. And that's a fair bit faster than previous, which was around 5 to 6 days.
Thank you.
Peter Jackson of The Telegram, do you have a final question?
Yes, hello. Sorry.
You're still there, Peter, yep.
Thought I heard a beep. The news that we're getting about Omicron is that it's actually nightmarishly contagious, something that most officials haven't seen at all. Is it time of year playing a role in you're not actually taking stricter measures? Did you consider like a complete sort of circuit breaker?
At this point, no, we haven't considered that. Obviously, we want to be able to maintain society functioning as best we can for as long as we can. And we're trying to put measures in place that will allow us to do that. I think, as you said, how quickly this is spreading, it's not going to be like the original strain when we shut things down, and it seemed to really make it really helped us to be able to stop that spread and importation. I think we're going to continue to see cases of this, and what we're doing now is just trying to slow that importation, slow that spread, and it's up to all of us to really be able to do that. We all have a role to play in doing that. So keeping your contacts low, staying home if you're sick. Again, I cannot stress it enough. If you have symptoms, if it's aches and pains, stuffy nose, a sore throat, any of those things that you might think is just a cold, it might not be a cold. And in fact, at this time, we need to assume that it's COVID until you prove it otherwise. So you need to stay home, and you need to have a test. So those are things that we can all do. It's our collective responsibility to try to make sure that this doesn't get out of hand. So really, we need to remember all of those tried and true measures that we've had used before. Sorry.
Thank you.
Thank you, everyone. Premier, do you have any final comments today?
Sure. Thank you all for joining us. I'd just like to follow up on Dr. Fitzgerald's previous comments and answer to the question. Of course, no one wants to deliver this news during Christmas, but It is certainly the news that we have to deliver, and COVID doesn't know that it's Christmas time, unfortunately. So regardless of the time of year, regardless of how special it is for all of us, we want to make the right decisions for Newfoundlanders and Labradorians to keep them safe, to keep the economy open as best we can, and to mitigate this new variant moving into the new year. So please be safe, limit your contacts, look after each other, and most importantly as well, look after yourself. I know there's a lot of people suffering with mental health and anxiety issues with news like this, but please look after yourself first and foremost, and then each other. Thank you.
Thank you, Premier. Thank you, everyone, for joining us today. Take care and enjoy the rest of your day.